Hello everyone, welcome to Dr. Chan's Minor Ailments Forum today. So today's topic will be dementia. And why have I chosen this topic is because I've recently attended a dementia conference locally and I've learned a lot. So I thought that I would just share my experience with you. From the conference, I've learned that it is important to make an early diagnosis of dementia, and also once it's been diagnosed, we need to provide a support not just for the patients but also for the carers. And I think that dementia care would be much better if these things can be done for them, because at the moment what I feel is that quite a lot of people might have this condition. Either one, they're not presenting to the surgery and be diagnosed, or people just think that it's part of the aging process, so it's nothing wrong. But actually, if it's diagnosed at the right time and provided treatment and management, some people can have a much better quality of life rather than just let it go on and it'll be too late to treat by then. So I just want to say that this show will just concentrate on the basic of dementia, and the next show will be talking about different causes of dementia. For example, Alzheimer's disease, which is one of the most important ones that we need to know. So firstly, I just want to bust some misconception, because people think that dementia is only associated with poor memory. So people said, especially some elderly patients come to see me and said, my memory is not as good as before. I think that I've got dementia. I can't say that they're wrong, but I can't say that they're entirely right either, because poor memory is only one of the aspects of dementia. Now, interestingly, there's so many reasons why people have poor memory, including myself. So you don't have to be old to have poor memory. For example, let's say if you have been working very hard, you're tired, so that your concentration is low, then that can affect your memory. Now, some people might be depressed or actually having some sort of low mood or even some psychiatric issues. So sometimes, their memory can be affected as well. Now, if you've listened to the previous shows, you might remember that we talked about several things like low thyroid or anemia or lacking of some sort of chemicals like vitamin B12 and folate. In these sort of cases, patient might actually complain that they feel very slow mentally and they find it hard to retain information. And somehow after you've treated them, their mental capacity can get back to how they were like before, and that's important to remember. Now, age, of course, is one of the reasons why people have poor memory. But this doesn't mean that they have dementia, though, because quite a lot of the time, poor memory is just part of the aging process. And these people might find it hard to learn new skills. For example, some elderly might say, I don't go online because this is new for me. Or some might actually say, I find it hard to remember names, or find it hard to kind of remember the words for certain things. But actually, they are coping really well. They still look after themselves and they do their own shopping. So I would not say that in that case they've got dementia. I think that's just part of a natural aging process. Whereas dementia is slightly different in a sense that it comes on gradually, and it's not just affecting the memory, but I'm talking about high executive function, for example, doing calculation, doing normal tasks or problem solving, etc. So what causes dementia, you might ask? Well, there are several conditions that potentially cause dementia. However, the most common ones are, for example, Alzheimer's disease, vascular dementia, which means that the blood vessels in the brain is affected, causing dementia, and also Lewy bodies dementia. Now, they all share similar symptoms, but on a molecular level or even on a physiological level, they're different. And sometimes they might have specific presentation that help us to point towards which kind of dementia they're having. However, at the moment, I won't get into any details of these conditions yet, because I would like to concentrate on the symptoms of dementias, how it's present and how to diagnose first. Now, according to Alzheimer's societies online, it says that there are around 800,000 people with dementia in the UK at the moment. And if I see that this number will go higher, because number one, our population is aging, and number two, we're just better at diagnosing it, really. So in a general sense, the older that you are, the more likely you'll get dementia. And it's estimated that by the age of 95, nearly a quarter of these people might have dementia. That's quite a high number, I must say. Now, however, the above statement is not entirely true because dementia can affect younger people too. And number one, they have got a type of dementia called young onset one, which can affect people younger than 65. But there are also other conditions that put you at a higher risk of getting dementia. Let's give you some examples. For example, people who's got Parkinson's disease or people who's got Down syndromes are more likely to get dementia at a younger age when compared to other populations. Now, let me give you one prime example of a celebrity that we know who's got young onset Parkinson's disease, and that would be Michael J. Fox. Now, understand that he was diagnosed with early onset Parkinson's when he was in the 90s. And obviously, you can imagine the impact on his life is quite tremendous. However, as far as I know, he hasn't got dementia yet, but it is well known that dementia is associated with Parkinson's disease, and I hope that he won't get it. But that's why he has set up a foundation under his name for research of Parkinson's disease, and I think that's really admirable, and I hope that via that we'll find some new ways of diagnosing dementia early or Parkinson's early, so that people won't suffer the sequelae of Parkinson's. Now, there are other risk factors that potentially put you at a higher risk of getting dementia. For example, if you've got quite a lot of cardiovascular disease risk factor, for example, let's say if you suffer from high blood pressure but really badly controlled, or you've got high blood pressure and diabetes, and all these stuff add together, if they're badly controlled, potentially what it would do is causing damage to your blood vessels. Now, obviously, we've got different sizes blood vessels in our body, so you can imagine that if they are damaged, especially the one in the brain, they're quite small. Eventually you might end up having a vascular dementia, which is related to, let's say, if you had stroke before, you might have vascular dementia down the line, but it's not always, but they're associated anyway. Obviously, family history play a big part, and in some severe psychiatric conditions, for example, schizophrenia and severe depression, these patients are also having a higher risk of getting dementia when compared to others as well. But at the moment, the reason of this link is not so clear. When I'm researching for this show, I found two interesting facts. And number one is apparently people with lower IQ are associated with higher risk of dementia. That's according to patient.co.uk. And also people who does little physical exercise could put themselves at a higher risk of dementia as well. I think the second point I can actually explain is because, let's say, if you do less exercise, you might be having a higher BMI or overweight. So in that case, it might put you at a high risk of getting cardiovascular disease. Hence, you'll get dementia. But I'm not so sure about people with lower IQ associated with higher risk of dementia, though. That's an interesting thing to think about, I think. So let's briefly talk about the symptoms of dementia then. Now, as I said earlier on, it's not just the memory being affected, but also how the person performed the daily tasks. For example, regarding memory-wise, you might notice someone have a short-term memory problem first. So they're able to remember stuff that happened 20 years ago, especially those elderly patients that actually gone through the war, and they might come in and tell me, I remember what happened when I was fighting, etc., in really good details, whereas they can't even remember what happened just 15 minutes ago when we're having a conversation. They might say they've got difficulty finding words when they're talking to people, or they might be talking to friends, but they can't remember the names. They might actually ask the same question again and again. And that's normally reported by the family, actually, because these patients might not actually remember they've asked the questions. Now, when it's progressed, not just the function is affected, but also the languages is also affected as well. For example, they will find it hard to express themselves or understand people. Even it could be a verbal thing that they don't understand, or maybe they're reading and they don't understand the words. And that can come with confusion and disorientations. For example, if they go to a new environment, they might actually feel really disorientated and get anxious, and that can be a major problem. This is more common to see in a hospital setting. For example, someone who might have dementia but never been diagnosed, but they recently got admitted to a hospital. So while they're in hospital, they might be showing more signs of dementia when compared to they're at home, because they are used to their environment at home but not in the hospital. Now, the mood can also be affected as well, and there's quite a lot of people reporting that patients with dementia might slowly progress to have a personality change or acting in a way that they never used to act, like out of character. If they were very kind of chatty before, they may suddenly become really withdrawn and keep themselves to themselves, or even the contrary. For example, someone who's really timid and polite, they suddenly become really aggressive and saying things that they shouldn't be saying to people. Hallucination can be a problem as well, especially in a certain type of dementia. For example, in Lewy body dementia, which we'll talk about later on, that these patients do suffer from visual hallucinations, as in they're actually seeing animals in the bedroom which they're not there. So how to diagnose dementia? I think number one thing to do is to go and see your GP first. Why? Because this is not just an observational thing, but we need to kind of be careful with, are they lacking of some chemicals that need to be replaced? Like, for example, if they're low in thyroid, you replace that. Or are they actually having a urine infection? Because that's actually quite a common thing for people to act out of the character or confused or having memory problems. So if you kind of do a screening test, for example, we do a memory screening blood test and also check the urine, then we can surely say that the presentation is not related to anything organic that we can do or treat. Now, obviously, memory test is important, and in the GP situation, we sometimes use a test called GP-COG, GP-COG, or another test called MMSE. So in these kind of tests, we're basically asking a certain question. For example, the orientation of time, date, and person, checking their short-term memory, maybe giving them a few things to remember and come back and ask them again, checking that they're able to write and able to understand instruction, etc. And depends on how high or how low they score, then we consider referral to a specialist. Now, from the conference that I went to, I have learned that in our region, for example, the Sussex region, we're definitely doing a community-based memory clinic, which are run by specialist GP. So what would happen is I will see a patient, I feel that they need a referral, and I'll do the appropriate blood tests and also do a CT brain scan. Now, the reason is not using a CT brain scan to diagnose dementia, but actually to rule out other things that can mimic dementia symptoms. For example, some patients actually present with symptoms like that and they're quite young, and they have a CT scan showing that they might have a brain tumor. Then obviously memory clinic would not be the right place to refer to, and that person might have to be referred to neurologists, etc. So once all these tests are done, then I can do a form to the memory clinic assessment, and the patient will be seen and they will be given a diagnosis. Now, a diagnosis is important because although you might think that it's only for academics knowing what type of dementia, but a certain kind of dementias actually can have treatment for it if it's caught early. For example, Alzheimer's disease, there are actually medications that can be used in early stage of the disease to kind of prolong the independence of the patient so that they can kind of look after themselves for longer. And especially in those who've got vascular dementias, the most important thing is to remove the cardiovascular risk factors. For example, make sure the blood pressure is well treated and stroke prevention, etc. So having a diagnosis of dementia doesn't only affect the patients, but also affect the people around them as well, especially the carers. So the carers will also be provided information on respite, not just for the patients, but also for the carers, because they do need time to rest as well. And also other societies or associations that are able to provide care for patients with dementia, and it's invaluable. So in this show, we have been spending some time whizzing through what is dementia and what causing it and how we kind of diagnose it. So I think the most important take-home message is that if you suspect someone who's got a memory problem that is progressing, and especially their family members, and also if you're feeling that you've got that problem, number one thing to do is to go and seek help from your GPs to do the appropriate tests and to be referred accordingly, because if we catch dementia earlier, then we have got better chance of treating it, and also ensure that the patient's quality of life is not affected, or at least to prolong the independence for as long as we can. So next week we will catch up on different causes of dementias. And until next time, take care of yourself. Bye bye.